Hello, everyone. My name is Dr. Ben Buchanan, and I'm a clinical psychologist and the co-founder of NovoPsych. It's my pleasure to welcome you here tonight for a webinar with Dr. Stan Steindl about compassion-focused therapy. I personally wanted to put on a therapy, a webinar about compassion for a long time, mainly because I fear that me living in the world of psychometrics and assessments, I noticed that people weren't necessarily thinking about using high quality assessments for things like compassion, and they were more using it for things like depression and anxiety. Whereas having really great assessments for something like compassion can just be so critical for a successful therapeutic journey. It's really great to have everyone here tonight. I would encourage everyone, if you haven't yet, to self-administer the self-compassion scale. You can use the QR code on your phone behind me, or in the chat, I'll just put the link where you can use it, where you can find the link and click on that and do it on screen as well. It's um, uh, and it's really great to have so many people. We've had over 3,000 people register. Some people will watch the recording, but at the moment, I'm expecting over 500 people live tonight to hear from Stan, and so it's just fantastic. I think the majority of people are from Australia, but we've got people I can see from New Zealand, South Africa, Malaysia. So welcome everyone. So now I'd like to introduce Dr. Stan Steindl, who is a clinical psychologist in private practice at Psychology Consultants and is also an adjunct professor at the School of Psychology, the University of Queensland. He is the co-director of the UQ Compassionate Mind Research Group and the convener of the annual UQ Compassionate Symposium. He's the author of many books, um, uh, two of which are Compassion in a T-shirt and The Gift of Compassion, How to Understand and Overcome Suffering. But my favorite medium to consume Stan's content is on his YouTube channel, where he puts out regular YouTube videos interviewing lots of really interesting people in the world of compassion. So, Stan, welcome.
Yes, well, I'm delighted to be here with you all. I'll define compassion as a motivation. Maybe do a little critique of some of the current compassion measures, and then sort of talk about how MI was the framework, I guess, that I use, bringing my two loves together, motivational interviewing and compassion. Using MI as a framework for assessing compassion motivation, the development of the compassion motivation and action scale. We'll talk a little bit about the CMAS in clinical and research and its clinical and research implications, but sort of dive a bit into a case study as well, just to kind of bring to life the use of the CMAS in routine outcome monitoring and just what it can kind of tell us along the way when we're doing our treatment plans. So compassion as a motivation, I suppose I do draw a lot from Paul Gilbert and his particular model of compassion, a kind of an evolutionary based biopsychosocial model of compassion. And he might say that compassion is a sensitivity to suffering in self and others with a commitment to try to alleviate and prevent it. And if you'd like a bit more exposure to Paul's model, there's a couple of references there. The 2020 article in Frontiers in Psychology would be a great place. It's quite a detailed article, really, and Frontiers is open access. So, yeah, certainly if you're curious about his work, that Frontiers article would be a great place to start. But there's quite a bit in that definition. It's a sensitivity, it's an awareness, it's a noticing um, of suffering. And that's kind of key. Compassion in a way is sort of definitely related to, but also somewhat different to things like kindness or being nice or even love, because compassion really is focused on suffering. And in self and others, in the definition, it really includes the self as well as compassion towards others. And it comes along with a kind of a motivation and a commitment to try to alleviate and prevent that suffering. I was actually speaking with a psychiatrist, Tony Fernando, on my YouTube channel recently, and he sort of said it's a kind of a motivation and commitment to help people find peace and contentment, especially in the kind of the chaotic world and the kind of life difficulties that can sometimes arise. So, in a way, compassion is an algorithm. This is one of Paul's particular ideas and thoughts at the moment, compassion as an algorithm. Compassionate engagement, which is kind of the first half of the definition, the sensitivity to suffering in self and others. That's the kind of compassionate engagement, and it's kind of like a feature detector, or a sort of detecting the stimulus, detecting signals of distress, need, and suffering. And then compassionate action, the second half of the definition, with a motive, with a commitment to try to alleviate and prevent it. That's the action system, or the response, taking steps wisely to alleviate and prevent suffering. So it's kind of a stimulus and response, noticing suffering and taking helpful action. I don't know if you've come across this joke, but it's one of my favorites. It's why does Pavlov have such lovely hair? It's because he uses classical conditioning. But anyway, compassion as an algorithm. So the threat protection motivation is also an evolved and innate kind of stimulus response algorithm. The stimulus might be the threat or danger to oneself and others, and the response might be doing something in an effort to protect, the fight, flight, freeze, appease response. So there's a whole range of these kind of algorithms that have evolved that in one way or another in the aid of our survival and reproduction. That's the sort of the evolutionary aspect to CFT, certainly. So compassion is the motivation to engage with suffering, plus the motivation to take helpful action. So compassion is a motivation, and towards self or towards others and the self. Um, but what's the effect on psychological distress and well-being of compassion or self-compassion? Well, a little while ago now, 2017, James Kirby, Cassie Telligen, and myself published a meta-analysis of compassion-based interventions. So we included a range of interventions in this particular paper: CFT, MSC, compassion cultivation training, and various others. And we kind of found that cultivating a compassionate motivation is helpful. It helps to increase compassion and self-compassion, of course, and mindfulness. It helps to decrease depression, anxiety, and stress, and it helps to increase life satisfaction and happiness. And really, to some medium effect sizes, there seem to be real value in cultivating compassion. But of course, there are motivational inhibitors. Barriers can arise in terms of both motivation to engage and motivation to take action. For example, engagement with suffering is tricky. It's difficult. It takes kind of sensitivity and sympathy and strength and coping and empathy and non-judgment and this care for well-being, and all of that is tricky, is difficult, and can itself lead to personal distress. In fact, when it comes to self-compassion, engaging with our own suffering can also be tricky, and we start to. Kristen Neff has sort of coined the term backdraft, which is that idea, like the fire person who sort of is attending to a fire and they touch the door to see if it's hot, because if they open the door, the oxygen goes rushing in and the flames come rushing out at you. And self-compassion's a bit like that. When we open the door to our own suffering, often the emotions that arise can lead to personal distress. And that kind of activates the threat protection motivation, both when we're being compassionate towards others, but certainly self-compassion, it can arise in our threat system. And so that sort of motivates us away from the suffering, just to kind of cope with and reduce our own distress. So can we assess all that? Can we find a way to assess compassion motivation, maybe the ups and downs of our compassion motivation, as well as the change in compassion motivation over time? The self-compassion scale assesses overall trait levels of self-compassion and correlates with measures of psychological functioning. A very popular outcome measure, as I say, for compassion-based interventions, and used in a lot of CFT research, although CFT is coming from a different theoretical perspective and defines, I guess, compassion slightly differently from the mindful self-compassion approach. The measure has come under some scrutiny for its factor structure and psychometric properties, and some of that I think is sort of recent still and ongoing. Doesn't assess compassion for others, and doesn't explicitly assess this notion of compassion motivation or action. The fears of compassion scales is, it sort of assesses the inhibitor side, the fears, blocks, and resistances to compassion, and actually across three flows. So it explores the fears for compassion for others, fears of compassion from others, and fears of self-compassion. And it too correlates with measures of psychological functioning. And is widely used and clinically useful, especially in the context of CFT, where really a lot of the work is working with the fears, blocks, and resistances. But fears of compassion aren't necessarily the inverse of compassion. So it's not quite a proxy for measuring compassion itself. Someone might have fears of self-compassion and be quite self-compassionate at the very same time. And really, so the FCS doesn't really assess compassion motivation or action in that more specific way either. And the compassionate engagement and action scales, the CAES, measures compassion, engagement, and action across the three flows. It touches on motivation and action via a couple of items. So each of the three flows scales has a couple of items. I'm motivated to engage and work with my distress when it arises, would be an example of compassionate engagement motivation. I take actions to do things that will be helpful for me. That's a kind of an action sort of an item. And this correlates with measures of psychological functioning and really does enable measurement of CFT processes and evaluation of CFT outcomes. Includes the three flows, so compassion for others, from others, and for the self. But it doesn't provide a kind of more in-depth look at compassion motivation. So we really wanted to try to create a brief measure that was drawing on an established theoretical framework of motivation and action and designed really for repeated measurement and assessing change across time. We thought that could be useful for both research and clinical work. So enter motivational interviewing. MI, as you know, is a therapeutic approach that enhances motivation for change by exploring certain motivational language, which we think of as change talk. 2013 was the Miller and Rolnick kind of motivational interviewing book, the third edition. There's now a fourth edition in 2023. So all of us MI people were very excited about that. But basically, change talk refers to the desire, ability, reasons, and need and commitment to change. So what would I like to change? How would I make this change? What are the reasons for making this change? What makes this change important to me? And what I will do. And so what might be the motivational language, the dance, if you like, of compassion and self-compassion? So James, Cassie, and I published another little paper thinking about motivational interviewing in compassion-based interventions. Really, the idea is, how do we help people to navigate some of that ambivalence or those mixed feelings that people can have about self-compassion, for example? I mean, they might have certain arguments in their mind against self-compassion. Self-compassion is too much like self-pity, for example. But then they might also have certain arguments for self-compassion. You know, like, if I could be more self-compassionate, then my children would also be able to model self-compassion for themselves, and you know, we wouldn't be so self-critical. So this idea of using MI to help people navigate the mixed feelings that people might have about something like self-compassion. And so out of that, we designed the compassion, motivation, and action scales. We recruited 621 adults from Australia, USA, and New Zealand, and there was 81% female. So that was sort of, it's a similar kind of ratio that we sometimes find in compassion-related research. It would be great to sort of explore this with the other genders. But they completed 84 items. We generated an 84-item list of DANSI for compassion and self-compassion. Then we divided the sample into two and did an exploratory factor analysis and a confirmatory factor analysis, and ended up with a 12-item compassion scale and an 18-item self-compassion scale. And each of those had 3 subscales: intention, distress tolerance, and action. We also administered the self-compassion scale, the fears of compassion scale, the DAS-21, and another measure called the forms of self-criticism and self-reassurance scale. And these are the items. You've all had a go at it, so I'm not going to linger here, but an intention item might be, I want to be kinder and more caring towards people I don't know. That would be desire. Distress tolerance might be, I'm able to cope with my feelings in response to another person's suffering. So that would be ability. And then action. Over the past week, I've been more helpful than usual, which would be coming from commitment and taking steps. The self-compassion scale of the CMAS is at those same 3 factors. I wish to be kind and caring towards myself. I have the ability to be supportive of myself when I feel like I've failed. I have been treating myself in a more gentle and caring way over the past week. And so some of the highlights: distress tolerance of both the compassion and self-compassion scales performed the best. And this really sort of confirmed the importance of distress tolerance in compassion. Distress tolerance was really about self-efficacy and ability change, or coping with suffering, and confidence around enacting compassion and self-compassion. Intention for the compassion scale didn't perform as expected, with sort of low associations, some significant but low associations. Could be just the number of items there. The intention in the self-compassion scale performed better, but we thought intention is important, but without distress tolerance, intention alone may not strongly predict compassionate responding. People might need the intention and that sense of confidence and ability. And then, of course, the unique contribution here is the action piece for both compassion and self-compassion. The CMAS is action, compassion action subscale didn't perform particularly well, but the CMAS self-compassion action scale did, and was significantly correlated with depression, self-hatred, and inadequacy. Which actually, like, research has generally found stronger associations between self-compassion and mental health compared to compassion for others and mental health. But we had some clinical and research implications. Distress tolerance, one's ability to cope with feelings of distress when approaching suffering, is particularly important. So we want to attend to the client's perceived sense of distress tolerance, maybe through conversation, using the CMAS as part of guided discovery. What's the distress tolerance like for the person? And we want to explore and elaborate on the client's ability change talk, building coping self-efficacy and building confidence and identifying strategies for tolerating distress. And the assessment of action. The CMAS can be used as a repeated measure of a client's compassionate and self-compassionate action across an intervention, gives insights into differentiating which components, which sessions, which modules of the intervention are actually facilitating change, and applicable in therapy and research, I guess, especially trying to the dismantling or process of change type research, and sort of trying to understand the role that, for example, self-compassion plays in helping people change. There are some limitations. It would be good to follow this up with a clinical sample, and across different cultures as well. More research into the CMAS, especially in terms of the relationship with different aspects of mental health and so on. And it'd be really cool to explore whether the CMAS predicts behavioural measures. For example, would changes on the CMAS predict changes in, say, charitable donations, or those kinds of more behavioural outcomes? So we wanted to develop this brief, user-friendly, public domain kind of measure of compassion and self-compassion motivation and action. So based on the EFA and the CFA results, and the various other psychometrics, we've got this measure of compassion and self-compassion motivation and action. Seems to be a robust measure, especially useful in terms of the self-compassion scale. And you can use both scales, or you can use them separately. I must admit, I've found myself mainly using the self-compassion scale in my clinical work. And here's the exciting bit for me, is the CMAS going online or went online with Novapsych. So that was a joy and a pleasure to sort of see it come alive on Novapsych, and hopefully be available and hopefully helpful. Woohoo, there it is, sitting there amongst a whole bunch of other really useful measures as well. Ben and his team has done a brilliant job in the sort of the information that's provided there, as well as the way that the results are presented. And you'll see a bit of that in a moment. Because I'd like to do a bit of a case study, just to kind of show you how you might use the CMAS with your clients. I thought I'd present Nuala, not her real name. 28-year-old woman. Partner is Nigel, who's an electrician, runs his own business. They have a daughter, Taylor, who was 10 months old at the time. Yes, named after that Taylor, which I thought was very cool. By the way, I went to see Taylor Swift in Sydney back in February. So I got dressed up and I swapped bracelets with everyone, and sort of squealed with delight, especially when Love Story came on. That really got me going. It was with my daughter, by the way, so if that makes you feel better about it. But so Nuala helps Nigel with the invoicing, the banking, the bookkeeping for his business. It sort of adds a bit of an extra responsibility to her already busy life as a new mum. Taylor's not sleeping well at this stage when Nuala presented, and so this is affecting her sleep, and she's sort of pretty exhausted. She's lost touch with her friends, hasn't been going to Pilates. There's a bit of a sense of isolation and just lack of personal time. And she feels down and overwhelmed, and she's struggling with feelings of inadequacy, starting to think that she's a bad mum because she's not managing everything perfectly. in terms of a bit of a CFT formulation, if I hope this is of interest. But from the historical influences, the early emotional memories in her family, success was valued, but emotional struggles were downplayed. Her parents were caring, but really emphasized toughness and independence. So she just sort of learned to manage everything alone, and associated struggle with weakness. She sort of learned to view herself as a bit sort of, it was a tricky one, both inadequate and yet having to do things on her own and responsible for managing everything perfectly, and viewing others as likely to judge her if she shows weakness, and that she's kind of required to support others but can't be a burden on others with her own emotions. There's various key fears there: the external fears of being judged as a bad mum or someone not coping, and also fearing Nigel's disappointment if she falls behind in her responsibilities, and certain internal fears, fearing failing as a mother, leading to just deeper feelings of inadequacy, fear of vulnerability, viewing it as a weakness, fear of not returning to her old self. I guess especially now that the baby's been born. And so she has a whole range of kind of safety behaviors, defensive strategies. Externally, she's sort of soldiering on, I suppose. She's continuing Nigel's business work to sort of maintain control there. She's sort of avoiding friends a bit, feeling ashamed for not coping like others. She's sort of hiding her struggles really to present I got this together type of a facade. And certain internal strategies. She's suppressing emotions, telling herself to just push through, ruminating on her perceived failings as a mother, and actually, and this became key, as we'll see, but using self-criticism as a motivator. Some of the motives behind this, and this is one of the things Paul Gilbert really emphasizes, is we want to explore thoughts and feelings and bodily sensations, and where does the attention go, and what are the behavioral urges. And we also want to try to work out what are the motives behind these strategies. What are the evolved motives? I mean, in a sense, it's threat protection motives. Basically, this need to maintain the image of a capable mother and partner, the motive around avoiding vulnerability to prevent rejection, the kind of relying on self-criticism to avoid failure. All of this really, in some ways, they're threat protection motives. It's a lot about social threats, and it's a lot about those fears around disapproval, rejection, being cast out of the group. And as like the evolutionary implications of being cast out of the group and alone in the wild is that you end up dead. And so these kind of this threat system activation really taps into a very powerful primitive kind of sense of threat and fear. The problem, of course, is that there are various unintended consequences of all of these strategies. The external consequences is she's just becoming more and more isolated, especially due to sort of avoidance of friends. There's a kind of a building strain on her relationship with Nigel. She's kind of hiding her struggles, and I guess he's getting frustrated too, not sure what's going on. And there's kind of burnout really from sort of taking on too many responsibilities, but without rest. Just sort of persisting, but without rest. And there's these internal consequences really too for her: heightened feelings of inadequacy and self-doubt, emotional exhaustion, sort of from suppressing some of these feelings, escalating shame, reinforcing that belief that she's really failing as a mother. The sort of the self-criticism and shame. I'm a bad mother. Really, I mean that starts to become kind of at the heart of things. And of course, CFT. Paul Gilbert really did develop CFT as a way of trying to work with self-criticism and shame. And so finally, all of this has sort of implications for her in terms of her relating, her self to self relating, first of all. She's highly self-critical, pushing herself to cope without rest. She's really struggling with self-compassion, viewing kindness as a weakness, and sees herself as needing to be independent and strong. I took part in a research program a few years ago where we sort of recruited a bunch of new mums who had kids, I think it was 2 years or younger, and we ran a kind of a sort of a bit of a brief intervention, a brief self-compassion intervention online, 4 modules, I think it was, um, and kind of, yeah, tried to see, can that be helpful to sort of mums, sort of a bit like Nuala. And it was so interesting because when we got to the end of the assessment and so on, something like 90% of the new mums felt that the program was very good for new mums, and very helpful to help mums cope with the transitions and some of the stresses and strains of parenting. And at the same time, about 50% of the sample actually completed the program. So there was this really kind of moving finding there, where the mums really felt that this was a really great and important program for others. But for me, self-compassion was really difficult, and I need to be strong, and I need to keep going for the sake of my baby, and kindness as a weakness, and all that sort of stuff. And I think Nuala really was in that situation. She was kind of having those sorts of struggles. She sort of knew that it was a good idea, and actually this bears out in some of the results I'll show you in a moment. But really struggled with actually putting it into practice. And then there was various sort of relating self to others, avoiding vulnerability with others, fearing judgment, feels inadequate comparing herself to other mums. She needs to keep supporting Nigel, but she's not someone who can ask for support, even from Nigel, I guess. What this what the CMAS doesn't explore, and this is a bit of a research goal of mine coming up, is the motivation and action around receiving compassion from others. Like, what does that take? Because in as much as compassion and self-compassion takes a lot of courage, so does receiving compassion from others. And so I think Nuala too was kind of struggling with the receiving side of things. So I thought I'd put Paul Gilbert up as if this is me, but it's not, of course. But anyway, so therapy really was the plan was to focus on cultivating self-compassion, trying to see if we can work with that critical inner voice, even changing the tone there of that self to self relating, and feeling more comfortable expressing her emotional needs towards others. Here's the treatment plan, if you like. And this is kind of a fairly sort of, I guess, kind of common way that I might kind of sequence things. And um, by the way, Nikki Petrocchi, James Kirby, and Beatrice Baldy have just published a compassion-focused therapy clinician's guide. So if you are interested in this and you haven't yet seen that particular book, it's only this year that it's come out. Check that one out because it has a whole lot of stuff about assessment and formulation and also treatment planning. Lots of client handouts and clinician scripts and various other session manuals and all the rest of it. But yeah, we did this kind of thing. I was thinking of it in 4 phases. The initial phase of just trying to establish a therapeutic relationship, and that involved clinical interview, assessment, developing a therapeutic relationship, creating a collaborative CFT case formulation, really trying to de-blame and de-shame and identifying tasks and goals and ultimately kind of agreeing on a treatment plan. The second phase is a kind of a psychoeducation phase, especially regarding the evolutionary model of compassion. So understanding the evolved nature of our tricky brains, that we get caught up in loops of the mind, the 3 circles model, which you may have come across and is a beloved model in CFT, really. And then introducing compassion, exploring the 3 flows, and maybe too, starting to work with the fears, blocks, and resistances to compassion across those 3 flows. And then phase 3 is getting into some of the compassionate mind training and the skills development. So we might start with the body-based practices, things like soothing rhythm breathing. We might move to some of the imagery-based practices, especially calm or safe place imagery, starting to construct an ideal compassionate other or the image of this compassionate friend or perfect nurturer, sometimes this is called. And then gradually using imagery, but starting to practice and embody the compassionate self, that part of ourselves, which really is compassionate across the 3 flows. Using even an acting approach, sometimes using chair work there. And then the 4th phase is really putting the compassionate self to work, if you like, so using the compassionate self to work with multiplicity, the multiple selves exercise, exploring anger, anxiety, sadness, bringing compassion to those different emotional selves, and then starting to work with the critical self, some psychoeducation around, for example, the ideal self versus the actual self versus the undesired self, the disappointment gap that can fall through there, the way that starts to lead to different forms and functions of self-criticism, the more self-hating, self-attacking, shame-based self-criticism versus the more self-improving, self-correcting, encouraging self-criticism. There's different forms and functions there. And so spending a bit of time working with all of that and then moving into some further imagery work and so on to really explore the critical self and start to activate the compassionate self and bring kind of compassionate self-correction and self-encouragement. Still wanting to have certain aspirations of ourselves, still wanting to achieve certain goals, still wanting to have success, but changing the tone away from that self-hating, self-loathing, self-attacking, hostile, vicious, brutal tone to something that's sort of warm and friendly and supportive and encouraging and so on. And then we did a little follow-up with Nuala after that. So let's see how things progressed. And Novopsych comes. I'm trying to think of how to sort of do the big plug. But anyway, I mean, well, the first thing is I use the DAS-10 and the CMAS self-compassion scale. And if we look at the pre-post measures, yeah, there were really great improvements on the DAS, and there were great improvements on self-compassion. I also use the forms of self-criticism and self-reassuring scale, and I use the fears of self-compassion scale. And actually, on all of the subtests there as well, there were really nice improvements. It's interesting because the hated self is kind of a bit of a proxy there for shame, and you know, we sort of had a you know, kind of a reduction there in both self-criticism and also that kind of sense of shame. The other interesting thing is that we had reductions in fears of compassion as well, but you know, she remained you know, just a little bit above the mean on fears of self-compassion, even at the end. Good, good outcomes, I guess, but not the full picture. So this is the DAS from NovoPsych, the DAS-10. And I suppose the sort of the interesting thing there is really looking at the pattern across time. There were these three curious sort of moments there, that, you know, really it was very helpful to kind of pick up on that along the way and to try to explore, you know, like, what's that telling us about where treatment needs to go. When you break it down a little bit more in terms of the depression and the anxiety scales of the DAS-10, there was that initial kind of uptick there in anxiety around session 4 or 3 or 4. There was another uptick of anxiety and stress sort of midway through, and then both anxiety and depression kind of represented the little speed bump there that we experienced further towards the end. And the interesting thing, I think, I felt, and was that you know, this is the self-compassion scale of the CMAS, and again, there was some kind of interesting little elements to the changes in self-compassion, motivation, and action over that time. There was a kind of a real flat sort of aspect to it towards the beginning. There was this sort of dip here, a kind of a flattening out again. And so if you look at the three subscales of the CMAS self-compassion scale, I mean, it's sort of, I think it's sort of fascinating, to be honest, in a way. I mean, there was this rapid uptick in intention, you know, the wish to be self-compassionate. There was this real flatness to distress tolerance, you know, the confidence around coping and the confidence around how to do the self-compassion and how to be in the presence of suffering. That was really flat for a long while. And the action kind of boom up, sort of, you know, ups and downs of self-compassionate action over time. You know, like what was happening here, where we had that kind of stalling on the DAS-10. What happened here, whereby self-compassion seemed to improve and then took a dive? And what was happening here? That the distress tolerance was starting to really improve, and then we, yeah, sort of like we kind of had something of a setback there. So yeah, what happened around sessions 3 and 4, sessions 6 and 7, and sessions 9 and 10, I suppose. Sessions 3 and 4. Now, this was the psychoeducation bit. This was where we really started to get into some of the core aspects of the CFT theory and psychoeducation, the evolved tricky brain, and introducing compassion and so on. And it was very interesting. I mean, she'd been making a bit of progress on the DAS. In those first 2 or 3 sessions, the overall psychological distress score on the DAS-10 was decreasing, and so on. But when we began to explore compassion and self-compassion in session 4, she hit a bit of a plateau. Not only a plateau, but as we said, see how there's a kind of an increase there in anxiety around that time. And, as we were discussing these concepts of compassion and self-compassion, it really started to bring up the fears, these deeply ingrained fears, blocks, and resistances. So it was this kind of sort of thing where, she really found it initially difficult to embrace self-compassion. The fears, it might make her seem weak or inadequate. Actually, now that I think about it, the fears really relate back to the early emotional memories, the key fears, that sense of I need to stay strong, I need to keep going, I can't be vulnerable, I can't be weak. And so, yeah. So as a result, we sort of found that, she's kind of in that thing. I wish I could be more self-compassionate. Of course, I'd rather not be so harsh on myself, but I don't know if I can cope, and I don't feel I can do it. Her distress tolerance, and self-compassionate action remained very low. And so there was this sort of, well, temporary stalling of progress at that particular moment. Now, of course, this is a common response. I mean, it's even in the treatment plan, actually. So there you go. Working with fears, blocks, and resistances, or certainly introducing this as an idea or a concept in CFT. It's common response, and it's a signal that that we've reached an important area of growth. As Paul Gilbert says, the work of the sort of working with fears, blocks, and resistances kind of is the work of CFT. And this is a really important area of growth. And so we want to be able to kind of validate those fears, blocks, and resistances. We want to be able to kind of explore and understand perhaps some of the origins of these fears, blocks, and resistances. And with careful support, we help to sort of work through these barriers and continue moving forward. Actually, going back to my Pavlov joke, that's kind of at the heart of it, isn't it? With fears, blocks, and resistances, much of it is conditioned learning. The care giving and receiving kind of system has been impacted, has been affected, has been perhaps even compromised, really, for some people. And so it takes a kind of a systematic desensitizing kind of approach, gradually exposing the person to the idea of what it would even mean to be self-compassionate, starting small and building up a little bit from there. So the next little bump or dip, bump for the DAS and dip for the self-compassion scale, was around session 6 and 7. Now, this was actually where we started using imagery and trying to disentangle safety and safeness. It's one of the things we're trying to do with CFT is explore the differences there, that safety and safety seeking is kind of arising from threat system activation. It's a kind of a threat protection, safety seeking mode. Safeness is where I've done all my checks and I feel safe now. which is kind of more arising from that soothing affiliative system. And so by around session 6, we're starting to think, can we use the body-based practices, but can we use some of the imagery-based practices to really start to, kind of connect with and experience that sense of safeness. So we use safe place imagery. So it sort of used to be called safe place imagery, but it's now more often referred to as calm place imagery, because some clients will say, well, I don't have a place where I feel safe. And so we're trying to sort of explore, might there be somewhere where you feel calm or grounded, or there's a stillness or feeling settled, peacefulness, comfort, some of those other words. And then in session 7, we construct the ideal compassionate other, the compassionate friend, creating an imagery of this being of some sort or another that has qualities of wisdom, strength, caring, commitment. So she'd been attending sessions by now. This is now 6 sessions in. And she'd be coming along weekly. And by the 6th session, she did feel a bit more connected with herself. She'd found small moments of self-care. This is the gradual kind of sort of exposure-based approach, just little things, enjoying a cup of tea while Taylor napped, even met up with an old friend. She'd started to sort of work with her harsher thoughts about motherhood, realizing that she was doing her best. Excuse me. But by session 7, she'd had a tough week. Taylor was teething. There were sort of more sleepless nights. She was more snapping at Nigel. And this kind of triggered a bit of a setback, I guess. Her DAS score was elevated a little bit there. She felt guilty about all of that too. And there was sort of the self-consciousness had started to kick back in as a result. Again, I'm a bad mother. She was making comparisons with, people's posts on social media and just how wonderful their experience of parenting was. And she'd kind of deepened in her own self-doubt, and leaving her feeling a bit defeated. I suppose it's interesting though, because the depression subscale of the DAS-10 didn't kind of increase. That continued on a sort of a downward trajectory, but she felt more anxious and stressed, I guess, as a result. And we found this reduction really in the action scores. So the stress tolerance was still pretty low. The intention was still really high, but the action, the taking steps, the self-compassionate action took a bit of a dive. In session 7, we created the image of a compassionate friend. And actually, that started to pave the way for more self-kindness, more acceptance. And as you can see, really, the sort of self-compassionate action kind of improved a bit again. And we started to finally get a little bit of an increase in her sort of sense around distress tolerance. And then the third little dip around session 9 and 10, well, this is where we started putting the compassionate self to work, exploring multiplicity, anger, anxiety, sadness, trying to bring compassion to to those parts of the self. But then we moved into some of the psychoeducation around self-criticism from there. And by session 9, we'd started using Mueller's compassionate self to address her anger, anxiety, and sadness. And what happened was it sort of revealed a rather deep well of suppressed anger for her. And I don't know if you've noticed this too, but I've often noticed that for those where the the anxiety or the sadness is really pronounced or kind of or dominant, beneath that is often a kind of an anger. And obviously for Nuala, she really was, kind of very, very fearful of her anger and fearful of the effect that her anger might have, especially in terms of, her relationships and how she might be viewed. And so we kind of started to recognize the anger. So it helped in a way to acknowledge these emotions, and it also stirred up intense feelings that perhaps she wasn't quite prepared for. So by session 10, when she returned, she was really much more in the self-critical frame, sort of overwhelmed by the anger, um, turning that anger towards herself, and kind of increasingly depressed. So, like, this is the time where, in actual fact, on the DAS, both the anxiety and stress and the depressed kind of factors do a bit of a spike. Her frustration grew, and she struggled again with distress tolerance. We had a little dip there in the distress tolerance factor. I don't know if you noticed when you were doing it, but one of the items in the distress tolerance is I have the ability to be supportive of myself when I feel like I've failed. And often I like to go to the questions, to the items, because NovoPsych very beautifully gives you the scores and everything, but down below you can actually look at the item by item scoring. And this was the distress item that really persisted as being kind of scored more in the disagree kind of side. And at this particular point, I noticed that she strongly disagreed again, even though it had been climbing a little bit towards, disagree or, somewhat disagree. It had slipped back to strongly disagree. And I think this was kind of a bit indicative of the return of some of the self-criticism. And so the emotional turbulence there kind of amplified some of the hopelessness, fed into some of the depression. But then discussing self-criticism sparked further progress. And basically, yeah, I think what happened from there was that session 9, was it session 9? Session 10, sorry, was the one where we started to talk about the psychoeducation around self-criticism, really tying it to some of the evolutionary motives, that sort of threat system activation, the connection with social threats and approval versus rejection, and so on. And then beyond there, we started to do there's a really great, oh yes, here it is. There's a really great imagery exercise, which is one of the set pieces of CFT. A number of these are the set pieces of CFT. But the functional analysis of self-criticism was something that we did then in session 11. And really the idea there is to imagine the critic as if it might appear outside of you. And what does the critic look like? What form does it take? Their facial expression, their voice tone, their bodily sort of postures or movements. What does the critic really say? How does the critic say it? The tone and so on. What does the critic feel for you? And then importantly, how does all that make you feel? And often people assume that self-criticism is going to motivate them or keep them on track or help them be successful. And this exercise, people often say, well, it just made me feel small. It made me feel unmotivated. And so there's a little kind of exploring there. What really is the function of self-criticism? Followed by a similar exercise where we imagine the compassionate self outside of ourselves. How does the compassionate self appear? Their facial expression, voice tone, body posture, bodily movements. What does the compassionate self have to say? How does the compassionate self feel about you? And of course, the compassionate self still wants the best for us, still wants us to succeed, still wants us to achieve, still has certain aspirations for us. It's just that they approach it with a warmth and friendliness and supportiveness and encouragement. We can still find a way to have that compassionate self-correction and self encouragement. And then the last bit there, how does all of that make you feel? And Nuala was feeling like perhaps she can do this. Perhaps this is something that she can work towards and make those changes. We then sort of followed up a month or so later at the end there. But just to finish up, the power of the CMAS in understanding compassionate change, I guess, with hopefully that's given you a little idea of how the CMAS self-compassion scale can give valuable insights really into therapeutic process, tracking process, but understanding and navigating some of those ups and downs. And we're wanting to sort of understand what are the improvements, what are the challenges, what can we learn from intention, distress tolerance, compassionate action in terms of the moving towards growth. And yeah, the tool provides a meaningful way, I think, to assess and support clients and yourself really in your practice. Not only offering a guide to treatment, but also deepening our understanding of compassionate change over time. So we're inspiring change. Try the CMAS in your own work today.
Thank you so much, Stan. That was really interesting. And we've got a bunch of questions. We've allocated 15 minutes for questions at the end. Mariana says, how long roughly does it take most people to start showing change on the CMAS?
Yeah. Well, what I find is that, and I think this is why what we found in the actual development, that the self-compassion intention increases quite quickly. That you actually end up noticing, I think, that people kind of see that it's a good idea. They know that there are good reasons for it. But the distress tolerance and action certainly take a bit longer. It's a bit hard to specify exactly for any particular person, but I think the key piece there is in the working with the fears, blocks, and resistances. And so giving some attention to that, validating and reassuring, supporting and encouraging people through those fears, blocks, and resistances. And then you start to see some change on the other two subscales. I really feel that the one to give, kind of real attention to is distress tolerance. That seems to be the one that really kind of starts to be most predictive of outcome.
I've got a question for you. What do you score on the CMAS?
Me personally,
Yeah.
I must admit, I didn't fill it out in preparation for tonight. I absolutely should have, but I didn't,
Oh, really?
didn't
Oh,
do
really?
it.
Because I mean, I measure on myself all the time on these things.
Ah, yeah,
I
yeah,
mean,
yeah, yeah.
I mean, it's so informative. I'll show you what I
Oh,
saw,
okay, yeah.
and everyone else as well. Hopefully you've got the email with your own results. I've actually been
Yeah.
tracking my self-compassion over time for a while.
Mm,
So started in 2022 on the 70th percentile for all three subscales, reduced a bit, but then just last week, actually, when I was thinking about this webinar, I took it again and was quite high. But it was interesting because
mm,
the reason I was higher on action was because I was actually a little bit sick and under the weather. And so when I'm sick and under the weather, I have to engage in more self-compassionate action than normal. And in fact, experiencing hardship and struggle, I think, for me, leads to higher levels of self-compassion because I lean on it more in those times.
That's a really beautiful observation. I think it goes back to the definition. Compassion is a sensitivity to suffering. When things are going relatively well, the self-compassionate action, sometimes might sort of reduce a little bit, I suppose, and get. I guess the trick is that the compassionate self starts to arrive when we need it most, is the idea. And that's why we're moving from learning about the compassionate self to practicing the compassionate self to embodying the compassionate self. And so that sometimes clients will say to me, like, I was lying in bed the other night, I was stressing, my husband was away, I'm thinking of a particular person, and he was away, and I was just feeling, I was spiraling. And then I heard this voice, slow down the breath, bring a warm, friendly smile to your face. Like the compassionate practice, the compassionate action just arose in her almost spontaneously, and that it gives you shivers up your spine when people are actually report something like that.
And we got a question here saying, under what circumstances would you administer both the CMAS self and the CMAS other? So measuring compassion towards others, compassion towards the self.
Yeah,
Or when would you do them simultaneously?
yeah, yeah. That's a really. I think one of the things that can be really helpful, especially in CFT, is that we can sometimes leverage off the very strong compassion for others that people have to help people to connect with that compassionate part of themselves, and then explore how do we widen that circle to also include ourselves in a
Yeah.
self-compassionate way. And so a
I've
really
just,
nice way.
I've just
Sorry.
shared my screen. This is actually a client of mine where I administered on the left the CMAS self, and on the right the CMAS other, and he scored, pretty high on compassion towards others, and then super low for himself, to the extent that
Yeah,
the intention for self-compassion was almost non-existent. You can hardly see it on the graph. And
yeah,
when
that's
I
true.
showed this
Yeah.
young man this comparison, it was entirely clear for him that there was a double standard there. And I think
Beautiful.
just made it so clear to him that there was yeah that even though he was a compassionate individual towards others, that he didn't afford himself that same luxury.
That's so good because I think we can use the measures and the beautiful graphs, by the way, as a part of guided discovery. Like that was a really beautiful guided discovery moment. And not only that, but also we can use it to sort of say, okay, so you know what it is to be compassionate. Let's explore that. What does that look like, feel like, sound like, and so on? And how can we just start that little bit of exposure towards kind of doing that same thing, but towards ourselves? I mean, it would be interesting to see what corresponding fears, blocks, and resistances were there for him too around self-compassion.
Yeah. Well, with this young man, actually, I couldn't get through his fears, blocks, and resistance. So I
Mm,
referred him into a self-compassion group.
okay.
And he did absolutely beautifully in that group.
Oh,
And
wow.
and it was interesting because my primary treatment modality is CBT. And so that just wasn't the right fit for him during that time. And he really needed a specific self-compassion treatment.
Can I comment on that?
Hmm.
Yeah, because I think one of the things that see because it's compassion focused therapy, so we can bring a compassion focus to whatever approach we're doing. And one of the things I think that sometimes this is what Paul Gilbert found was that he was a CBTer and he would find that people might do good cognitive therapy, but deliver it to themselves still with harsh voice tones or inner voice tones, and so the compassion focus piece might really just simply bring that warmth and friendliness and caring tone to the CBT that you're actually already doing.
Anna's asked, in is suffering to a certain extent good? Does it help us? Does it bring us about hope?
I actually think that certain difficulties, certain experiences really do provide us a lot of growth, and like it, we don't tend to grow as much from just constant happiness or something. Suffering, I think, really is a source of growth, not least in and around the relational aspects of our lives and being helpful towards others, allowing others to help us, finding that way to bring compassion to ourselves. I think that is actually one of the kind of standout human kind of characteristics that really can help us individually and in groups and in communities flourish. The problem is there's two problems. One is the fears, blocks, and resistances. So when we suffer, but we're reluctant around the compassion piece, then that's kind of difficult. And the other is that there are certainly there's a kind of a level of suffering or something that really is very, very difficult, and obviously we're wanting to really try to help alleviate that suffering for some people.
Yeah. Maria's just asked, is there who does compassion focused therapy work best for? And is there anyone that you would exclude from being a good candidate for compassion focused therapy?
Well, the core idea with CFT is working with self-criticism and shame. And so, Paul really has done a lot of research in those areas, and the compassion itself and self-compassion is sort of thought to be something of an antidote to self-criticism and shame, whether it be CFT or MSC or CCT or the various kind of approaches. I mean, the I was going to say good thing about that, but it's not really a good thing. But shame is universal, ubiquitous, everywhere, a part of many conditions. So in a funny sort of a way, CFT can be helpful there. It's been there's an evidence base around depression and anxiety, around trauma and complex trauma. There's an evidence base. There's a very recent RCT come out with eating disorders, and I'm helping actually an eating disorder service in America kind of implement CFT across their programs, their eating recovery kind of programs. And I'm not sure that there would be something that I would sort of caution you in terms of not using CFT with a uh, particular presentation. Even in forensics, there's some really great work coming out of Portugal and the UK around CFT and forensic populations. But of course, with these different populations, there comes along various kind of adaptations and so on. And so, I'd probably dive into the literature there just to sort of check where those adaptations and so on might be.
And the final question, Christopher's asked, I wonder how a highly sensitive person would tend to score. And someone else asked in a related thing, how do people who are autistic score on their CMAS?
The second question, I think, as I mentioned in my limitations, we haven't actually researched that particular topic. We we did do some research with the CEAS, the Compassion Engagement and Action Scales, and autistic traits, though not with those actually diagnosed with autism. But and we explored self-compassion and difficulties with emotion regulation and anxiety. And what we found was that self-compassion predicted anxiety, but was moderated by difficulties with emotion regulation. And so I think, that seems to me to speak again to that distress tolerance piece, and whether people are able to, kind of really have certain skills and strategies and emotion regulation skills as part of helping to sort of helping add to the self-compassionate motivation. What was the first question? Oh, sensitive
Highly sensitive
people.
people.
Yeah, yeah, it's interesting. It depends what you mean by highly sensitive, but it would be. I think the thing I would say there really is the only thing I can sort of say would be, I really do think that this needs to be administered with your clinical wisdom as part of it. Like we're wanting to really think, who is this person that I'm working with? What are some of the things I know about them clinically? Taking those into account as we're kind of administering and interpreting these kind of questionnaires. I mean, it'd be interesting, gender differences, cultural differences, clinical differences. I think there's a lot of really great questions
Yeah,
that
there
hopefully
are.
we'll go on to answer.
And I really do love the scale. I mean, the best thing about the scale for me is that the three subscales and the last set of questions asking over the last week, um, have you been doing actions which are self-compassionate? And so that's just really lovely because you get that change over time. Dr. Stan Steindl, thank you so much for your presentation tonight. All right, take care, Stan. Thanks,
Thank you,
everyone.
everyone.
Good
Thanks
night.
so much. Bye.